Most patients who have hepatocellular cancer are not candidates for optimal treatment, which would be resection or transplant. So you're left with 80% of patients who are diagnosed with hepatocellular cancer who are looking for other options. One of the big categories of of options for these patients is locoregional therapy, which essentially means therapy targeted to the liver, which is where most of the problems from this tumor arise. So my area is interventional radiology, and what we do is treat tumors either with arterially directed therapy, which can be bland embolization or chemoembolization or radioembolization or embolization with drug-eluting beads, and ablation, in which we treat a tumor with either thermal ablation, where we literally put a probe into a tumor and either burn it or freeze it, or in some cases we can use chemicals to treat the tumor. It's an important area because hepatocellular cancer is on the rise in this country. 20 years ago the incidence was somewhere around 1.5 per 100,000. Now we're up to 3 per 100,000, in part due to immigration, patients who have hepatitis B, say from Asian countries, in part due to the rise of non-alcoholic fatty liver disease, in part due to the fact that patients who contracted hepatitis C in the 70s and 80s have developed cirrhosis and are developing a sequela of cirrhosis, the most significant of which is hepatocellular cancer. So it's a large patient population, both in the United States and internationally, who can benefit from locoregional therapies.